Hi, Dr. Karima here, and we'll be recording another video of Australian Dental Council written part 1 exam. Again, a very important question to all those enrolled candidates and all those people who are watching my videos. I hope these have been helpful, and that's why I'm shooting more, because I keep getting your messages, which motivates me to keep shooting more and more videos to help you all. This particular question and the topic itself is very, very important because, firstly, all the staging and grading of periodontitis that you have learned so far, there's a new classification which is out there, and this is one is being followed throughout now. So, questions are based on this. It's no longer the original, localized gingivitis, localized periodontitis kind of classification. That's no longer there. It's staging and grading of periodontitis, which is being followed. A more comprehensive classification, better classification, but a lot of ifs and buts that you need to remember. And perio itself is a subject which we read more in theory and in practicals, like in your postings. After a long time, I use this word. You basically just do calculus and scaling, hand scaling, and when you're in internship, ultrasonic, you pretty much don't try and do classification of each patient or chart each patient with the staging and grading. So it becomes very difficult and complex for you to understand, because had you done this, had you been taught this by the teachers, it would have been more easier for you. But no worries, everything can be learned. You are a dentist, it's not a rocket science. The more you practice, the more you learn. If you're a practicing clinician, every patient you see, don't just see for caries, start seeing for periodontitis also, as in chart each patient. You may take a little more time for consultation, and the patient might think, what are you doing? And I came for this particular tooth, and this doctor is like poking things in my gums to check if I have a pocket or not. What is this guy doing, trying to find something which is not there? But you can tell the patient, you know what, since you have come for an examination, might as well do a complete examination. The patient will actually appreciate you, and you'll get to practice, right? And you'll get to imbibe and embed this staging and grading into your practice, and thereby making life easier for you. So anyways, let's start with the question. But before the question, let's just do a little summary. I've already made a very detailed video on staging and grading of periodontitis. Feel free to pause, go to that video, have a look at it, and then come back. I'm just summarizing this thing in short because I've already shot a big video about this, okay? So what is staging? Staging intends to classify the severity and extent of a patient's existing disease, based on the measurable amount of destroyed, measurable, okay? Basically, you can classify based on the measurements taken, amount of destroyed or damaged tissue as a result of periodontitis, and to assess the specific factors that may attribute to the complexity of long-term case management. Initial stage should be determined using critical attachment loss, called as CAL, critical attachment loss. If critical attachment loss is not available, I'm basically just reading this, okay? Radiographic bone loss should be used. Tooth loss due to periodontitis may modify stage definition. Due to periodontitis, not due to anything else. One or more complexity factors may shift the stage to a higher level. So, severity and complexity. What is severity is going to be classified according to the critical attachment loss. Not the gingival recession. It's attachment loss. Be very mindful of this term that I've just used, okay? Because many candidates make this mistake and mark a wrong answer because they get confused on gingival recession and the critical attachment loss. What I mean to say is, suppose your gums are recessed by 1 millimeters, but your bone has gone down by 3 mm, then your clinical attachment loss would be 3 mm, not 1 mm. Though the gums are just 1 mm recessed, when you have done your probing and taken the radiograph and you see the bone which has gone down, it would be the bone length which would be taken. That's the attachment loss. You understand? So always read the question properly. Have they mentioned gingival recession? Have they mentioned the clinical attachment loss, pocket formation, etc.? And then mark your answer. So interdental between two teeth, okay? Clinical attachment loss at the site of greatest loss, stage 1, 2, 3 and 4. 1 is 1 to 2 mm, 2 is 3 to 4 mm, 3 is more than 5 or equal to 5, and 4 is more than 5 or equal to 5 again. Now, many times people have got confused between the stage of 2 and 3 when it's said that the bone loss is around 4 mm all over, okay? And many people have somehow gone on to mark stage 3 because they see tooth loss and they see it's less than 4 teeth in stage 3 and there is no tooth loss in stage 2. They just somehow mix up the numbers of this chart and then mark the answer wrong. Read, learn, write it daily. Write it 10 times if you want. Don't get confused between the numbers. Complexity. Max probing depth is equal to 4 mm or less than 4 mm. Stage 2 max probing depth is equal to 5 mm or less than 5 mm. Now, when we'll come to the question, you will see there will be a question saying that the probing depth is around 5 mm. And then people have marked it as stage 3 because they have confused the probing depth as critical attachment loss depth. You're getting my point. The critical attachment loss is 4 mm and that is stage 2. But the probing depth is equal to 5 mm or less than 5 mm. But because the question mentioned the probing depth is 5 mm, what is your stage? And people have marked it as 3. Taking that as an answer. You get it? You have to see the overall scenario. Is it on one place or overall? And then mark your question. Don't get confused. So I'm just going over. So you have to memorize this tabulation of the chart. So that is your staging. Now coming to grading. What is grading? Grading aims to indicate the rate of periodontitis progression, responsiveness to standard therapy, and potential impact on systemic health. Your systemic health comes in grading. Systemic means your hypertension, your smoking, your diabetes. It comes in grading, not staging. Okay, grade modifiers. I'm directly jumping onto this. Normoglycemic or no diagnosis of diabetes is grade A. Grade B is less than 7, not equal to. It is less than 7. Grade C is equal to 7 or more than 7. Grade B is less than 7, not even equal to 7. It is less than 7. Grade C is equal to 7 or more than 7. You get my point? So many people again confuse this. Cigarette is understandable. Less than 10, okay, grade B. 10 or more than that, grade C. But it's the diabetes which is more confusing. The question say the patient is having 7. What is your grade? It's C because it's equal. Normoglycemic or less than 7 is grade B if it says less than 7. Absolutely normoglycemic and no history, then it's grade A. Understood? Now I'm keeping this chart open here and I'm switching to the question out here. 42-year-old male patient presented himself for examination complaining of bleeding gums. Okay. While reviewing his medical history, he disclosed that he is a non-smoker. Non-smoker, very good. But was recently diagnosed with type 2 diabetes. He claims his last HbA1c value was 6.2, less than 7. Non-smoker. So where am I? Immediately my grading, should be here. Non-smoker. But I have HbA1c as less than 6.2, less than 7. So I'm on grade B. Upon clinical examination, he had numerous 4 mm pockets and one 5 mm pocket. Okay. Now let's go to stage A. Numerous 4 mm and one 5 mm. Evidence of slight radiographic horizontal bone loss was also noted in that area. All teeth were present and biofilm was moderate. Okay. All teeth were present, no bone loss. 4 mm pockets, only one area 5 mm pocket. 4 mm pockets here, one 5 mm pocket, one which is here, okay, and numerous 4 mm pockets. So here 4 mm pockets, maximum probing depth 5 mm, mostly horizontal bone loss. Here it says slight horizontal bone loss. So because I'm having numerous 4 mm pockets and only one 5 mm, I fall into stage 2, not here. Do not go into stage 3 saying there is one 5 mm pocket. You understand? My max probing depth is here. My critical attachment loss is 4 mm here. My critical attachment loss is not mentioned more than 4 mm, so I'm not going to go to stage 3. So automatically what my answer becomes? Stage 2, grade B. Got it? This is how you do it. So when you go in the exam now, like when I had gone, I had asked them to give me a pencil and a paper, and you're allowed to have that. They give you. I went and I immediately made this charting before my exam began, because I know it gets confusing, but I had written down this chart and memorized it so well that I made that chart on the paper, and when this kind of question came, I read the question, I encircled, I immediately got my stage and grade, and I marked that, and I moved ahead in my exam. You understand? I was not stuck solving that question and doing calculations in my brain, because that would have taken more time, and you do not have time. Again, all the new candidates who are appearing for the first time, you have 70 questions to be solved in 2 hours. 2 hours is 120 minutes. You don't even have 2 full minutes for each question, and there are tricky questions. You will take more than 2 minutes on certain questions. So you do not want to miss not solving a question. You have to solve each question. So you should have the answers on your fingertips. You read the question, the answer should flash here, and when you have questions like this, you should have charts ready in front of you. So when you enter the examination hall and you're sitting, and before the exam starts, before you click on it that start my exam, make a chart on the paper right away. This chart, eruption chart, so you have things handy with you when such kind of question comes, and such kind of question will 100% come. Understood? Periodontal examination is very important, and in Western countries it's taken very properly and seriously. It's just that in our Asian countries we just skip that, because mostly people also come just when they have pain. The whole focus is on just treating the pain of the tooth. Nobody cares about the gums. You are also not so well versed in examining, because you barely have the Williams probe or that OHI probe with that ball end and nobody has patience to do that also, right? Unless the patient asks for it. So all these factors combined, such questions seem like a headache and difficult. But if you start practicing in your own clinical scenario, it will become easy. But either ways, write down this chart, memorize it, write it in the exam, okay? So your initial classification of this type is stage 2 grade B. Here we solved it. Now when grading a periodontitis case and countering risk factors, a grade B would consider it for someone who, grade B, does not smoke. Okay, in grade B we have less than 10 cigarettes. So answer is does not smoke is not correct. Normoglycemic, this is not normoglycemic. Has HbA1c less than 7? Yes. Has HbA1c more than or equal to 7? That's grade C. So you see, they practically gave you every option about grade B. So the answer is has an HbA1c less than 7C. It's not equal to, it's less than. Equal to or more than 7 is grade C immediately. You get my point? Now if I tell you the patient has 6.2% HbA1c but smokes more than 10 cigarettes, where would your answer be? Grade C. You understand? Now what are the essential requirements of a periodontitis case? Essential requirements. Okay, let's read the full options out here. Why this is not coming? Okay, the essential requirements are this: detectable clinical attachment loss at 2 non-adjacent teeth. So basically the question is saying how would you say this case belongs to a periodontitis? Like the classification, the diagnosis is periodontitis. How would you know that? You will know that only when you have a clinical attachment loss at two non-adjacent teeth, means not next to each other, different teeth, identification of the form of periodontitis, description of the case characteristics, and aggressiveness of the disease by stage and grade. Then only you will classify a case as having a periodontitis. Understood? Yeah, these are long options. When you solve my mock, you'll get the exact option. But when I start to solve like this without the answer, it comes out like this. But anyway, you get the idea. The other options are not giving a characteristic of periodontitis, but this one is. So directly I jumped onto this. So there is option A where it says detectable clinical attachment loss on at least 3 non-adjacent teeth. No. To classify as periodontitis, the minimum requirement is just 2 non-adjacent teeth, not 3. Okay, so remember that. Now, staging of periodontal disease includes severity and extent of current tissue and tooth loss. We did this, right? We just read it. Direct evidence of progression, indirect evidence of progression, presence of risk factors. Presence of risk factors is grading. Diabetes and smoking is a risk factor. Severity and extent of current tissue and tooth loss is what staging is about, right? Again, go back to staging. This is severity and extent. Go to grading. It's the risk factor. The new classification system differentiates gingival health and gingival inflammation occurring in anterior and posterior regions of the mouth. Okay. Unattached gingiva and alveolar mucosa. Okay. On intact periodontium, reduced periodontium, and stable periodontitis patients. That's a more comprehensive answer. On all mucosal surface of the teeth. No, we are not checking on all mucosal surfaces. We are not checking palatal mucosa. No, we are not. We are not checking the lingual mucosa. No, we are not. What are we checking? Intact periodontium, reduced periodontium, and stable periodontitis patients. Correct? So that is a new classification, a more comprehensive one, more specific one, I would say. This is a video. I am just showing you the picture of it. It gives in detail explanation about these two charts. So it's another voice speaking, it's another speaker's video. It's a very good video. So just for you to remember this, go to my video, the long one about periodontitis. In detail I've explained. 20 minutes video, that is. Listen to it. You are walking in the home, you are folding your clothes. Listen. Listening is also learning. Then you finish that, you want to revise, go to this video. Again listen. Do this every day until this thing gets embedded in your brain. The idea is to mark the correct answer in the exam, and you should take whatever steps necessary to remember the information which you are supposed to enter, which will help you clear the exam. Understood my point? Write it down, make a charting of it. Do this. You are a student, you are giving an exam, you have to work hard. This is new and it's a lot info, and there are ifs and buts combination. This is how the question will be asked. Understood? So I hope this is clear, and yeah, mention in your comments if you like it. It motivates me to make more videos in my hectic busy schedule, and off late I'm getting calls of people having midlife confusions, like three such people my own age. We passed at the same time RPG. They went on to open their own clinics in India. Now they're feeling the lifestyle is not matching as per their expectations, and various other things. They want to move abroad, and they call me and say what are our options and how we go about it. Basically in the same pool as you people who have just graduated and are wondering how to go abroad and settle down. So yeah, I just try to give my guidance best, but yes, amongst all the things that I have to manage, I don't want to say no to anybody, because I myself know how much guidance I needed, and the lack of it made me struggle so much. So whenever somebody is asking, I never say no. So yeah, a little bit of motivation helps when you're trying to do something and you get a good feedback. Then you think, okay, let's do more, because, like I said, this is just to help you all. I'm not getting anything out of it. So hope this helps, and yeah, I'll go back now. It's 9 p.m. I have to put my son to sleep. That is another task. He doesn't want to sleep at night. He just wants to play. I don't know, at night, young children just get some extra energy from somewhere. They are just so energetic. They just want to play. They just don't want to sleep. And my energy level is like low at night because I'm tired. I'm working throughout the day, you know. So, any which ways, have a nice day. Bye bye.